Hi, everyone. Welcome to RightSleep Sleep Chats. This is a series of short videos featuring RightSleep creator, Dr. Stasha Gominak, answering some of our frequently asked questions, as well as others you may not have thought of to ask. We'll tackle one question at a time to help you improve your sleep and ultimately improve your health. So today's question, Stasha, is, are there specific symptoms that let us know if the D level is low?
I am Stasha Gominak, a neurologist and a sleep coach. The symptoms related to low D are actually many. I'm going to tell you what I make you do using the workbook, and then I'll tell you why, and then we'll go over what the symptoms are. So we are lucky that we actually do have an accurate D level. It's the liquid chromatography mass spectrometry level of D. That level is more accurate than the usual test that your doctor is doing, which is an immunoassay. See some of the other videos about the specifics of that. But once you do your D levels, I'm having you do them every month when you start the program so that you can watch what your body says when your D is 21, and then listen to your body when your D is 45, and then re-examine what your body is saying to you when your D is 65. So you will have a whole list of symptoms that you will list in the workbook, in the journal section of the workbook, that you'll be following. And some of them, not all of them, will be directly related to what your D level is. Some of them will be directly related to how well you're sleeping. And some of them will be more related to the B5 that we're going to have in the B50 that's part of the program. So each person has a set of symptoms that are things that have been bothering them. Sometimes it's sleep. Sometimes it's my periods are heavy and painful. Sometimes it's depression. Sometimes it's anxiety. Sometimes it is I have high blood pressure, or I have diabetes, or I wake up with back pain. All of those symptoms have certain aspects about them that are related to either D directly or D's effects on sleep. And most of the material that I have on the website is about what the relationship is between the two. So it's very difficult for me to list all the symptoms that are related to D and how will I know what my D level is. Instead, I'm going to take you through what my personal experience was, and then you have to do your own personal experience and see which things go away when your D is in range between 60 and 80, and when your D goes slightly too low into the high 50s and slightly too high into the low 80s. My personal experience was that when my D goes low, I start to have a visual aura of migraine that I had for the first time when I was perimenopausal in my early 50s. And then I'll get a headache after it. And usually within 2 weeks of my D going below 60, I'll start to have those. But the other two things I usually get are I get a little constipated, and I also tend to wake up at 3 a.m. and I can't go back to sleep again. So even if I have a one wake up during the night, I usually can just roll over and go back to sleep. When I stay awake during the night after that wake up, it's usually a sign that my D is either too high or too low. For me personally, when my D goes towards the 80s, I get really creepy pain that is not necessarily joint pain. It's usually, for me, buttock and leg pain. And I just feel stiffer and older. I also get constipated, and I wake up at 3 a.m. and I can't go back to sleep again. So the one distinctive thing for going low is the visual aura of migraine. Now, other symptoms that other clients of mine have include sometimes anxiety. It's more common that depression is linked to D in anyone who's had depression. So one of the reasons why I tell you not to stop your D abruptly once you've started on it is that anybody who's had depression will frequently really feel that as depression. And there are many other physical symptoms. Some of them are pain, either awakening or generalized pain that's about inflammation. But there are many other things that you can follow that are as varied as my PSA titer that someone is following because I have prostate cancer, or I get up to pee 5 times, or I have a runny nose all the time. Basically, you have to actually be willing to listen to your body, go through the symptoms that you're having that we would give you drugs for. You would come to me and say, my nose is running all the time, and I would give you Flonase. Or you'd come to me and say, I have headaches all the time, and I'd give you a drug. These are all things that are suggesting that your body is not operating at its optimal place for you. It's not really the most perfect that your body can present itself to you. That means that there are many, many symptoms that can be related. And once you observe the ones that are consistent for you every time your D goes below 60 and consistent for you every time your D goes above 80, then you actually have some information that you can use consistently for the rest of your life. And the reason why we want that is we tend to focus on how many pills we're taking. So if I take 6,000 of D and I've been taking that every single winter for the last 3 winters, then I would expect to continue to take 6,000 in the winter. As I use D for longer, the amount that my body uses every day actually goes down. Once your deficiency state is actually improved, for most people, it's constant for the first 5 years, maybe 4 years, and then there's a little dip where they need less. So for the majority of patients who were seeing me as a neurologist, after the 4th year of taking D, we all had to go down a little bit, as though our deficiency state had been finished off, and now we're just using a certain amount.
All right. Well, thanks to the RightSleep program, I've learned for me, it's lower back pain and joint pain. So, all right. Well, thank you, Stasha. And thank you everyone for joining us. Please subscribe to the RightSleep channel, then like and share our videos. You can find more information about the workbook Dr. Gominak was referencing and the RightSleep program at drgominak.com. Remember, we see our doctor once a year because we heal our bodies every night. Until the next sleep chat, sleep well. Bye-bye.